Hello, 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 everyone. Welcome to Sunny Side Up. I am so happy that you are here. This is a special edition of Sunny Side Up. Sunny Side Up presents Pink October. We know that the month of October is very, very special for many reasons. Number one, it is the month that I celebrate my own birthday. Give it up, give it up, give it up, give it up. But it is also the month that we raise awareness for breast cancer. And so we have an amazing person with us today. I mean, I am privileged and honored to be able to have her here with us this evening, to sit down with us and to talk with us about what, breast cancer is and just all things breast cancer. And so I'd like to welcome Mrs. Marion Harris here to our Sunny Side Up show. Give it up for her, give it up for her, give it up for her. Sister Marion Harris, would you like to just kind of tell us who you are? I'm going to read your lovely bio, but we want to hear you say something about yourself.
Well, thank you, Sister Sunny, for thinking of me and inviting me to be here on this forum with you. I am honored that you would request me to come. I'm just a regular person. I love the Lord, love my family, love my church, love people. And I have a history of a long journey with breast cancer. You'll read my bio. I'm a healthcare professional, but I'm just a regular person trying to get by with ups and downs of life, and leaning on the Lord to lead me and guide me. But this is a pleasure for me to be here to talk about something near and dear to my heart.
Thank you so much for being here. Thank you so much for sharing. I'm going to get right into things. I'm going to start with your bio because it's an impressive bio, should I say the least. And I want everyone to know who you are. Um, and so I'm just going to start with reading, like I said. Sister Marion Harris is a registered nurse and has been a registered nurse for more than 50 years. Mrs. Marion Harris has earned a BS in nursing and public health and a public health nursing certificate and master's degree in nursing and education. For the past decade, Mrs. Harris has focused her professional and ministry life on the development of health and wellness programs in faith communities in the San Francisco Bay Area. She is active in many professional organizations on the national and local level. Miss Harris is a longtime member of Glad Tidings, International Church of God in Christ, COGIC in Hayward, California. Woo, woo, woo. Let's go, GTI. And serves as director of the Nurses in Health and Wellness Ministry and the Northern California jurisdiction of Church of God in Christ and board member for Glad Tidings Community Development Corporation. She is a former employee of John Muir Health in Concord and St. Rose Hospital in Hayward. She developed health ministry programs in local faith communities. She was responsible for developing health promotion and prevention programs to address the health disparities throughout faith communities and community based organizations. And these programs include best practice models of culturally competency and compassionate engagement of African Americans and Latinos. Additional, Ms. Harris has worked as a research outreach director for UCSF, Office of Community Engagement Breast Cancer, Second Opinion Study. She is currently an adjunct professor and fellow at Samuel Merritt University and co-chair of the UCSF Faith Communities Committee, Abundant Life Health Ministries Network. Marion is a two-time breast cancer survivor of 40 years who has the BRCA2 gene mutation. Marion uh, embraces opportunities to participate in activities to bring knowledge and awareness of the impact of breast cancer in minority communities with the goal of eliminating this disease. Sunny Side Uppers, let's welcome Mrs. Marion Harris. Mrs. Marion Harris. We are so excited. we're going to jump right into things because it's a lot that I want to try to cover. And even if we don't cover everything, we will most definitely give material that our sunny side uppers or viewers can look at or find, and where they can find things to answer any unanswered questions. So we'll just start right with, what is breast cancer? Is it just something that you can catch like a cold? Is it something that is hereditary? Um, what is it?
Well, when we think breast cancer, we just sometimes think that there's just one type of breast cancer. Cancer itself is when your cells stop functioning as they're designed to function. It's an abnormal cell growth. In breast cancer, there are several ways this can happen. There's a ductal carcinoma, and is the most common type of breast cancer, and starts in your milk ducts. There's lobular carcinoma, and it starts in the lobe of your breast, and most often is found in both breasts. Inflammatory breast disease is a rare and aggressive type of breast cancer, and it causes your breast to swell and get red and become very warm. And it's most common in young women and in Black women. Paget's disease of the breast is a rare type that affects the skin on the nipple, and it darkens the skin around it. Ductal in situ cancer is an invasive cancer where abnormal cells are found in the lining of the ducts. That happens to be the one that I had. Invasive breast cancer is any type of breast cancer that spreads to the surrounding breast tissue. And then metastatic breast cancer is known as the stage 4 breast cancer, and that's when the cancer has spread outside of your breast to other parts of the body. So when we say breast cancer, there's a lot going on. Also, we can talk about breast cancers that are classified as hormone receptor positive and hormone receptor negative. And that depends on the type of tumor cells that have estrogen and progesterone receptors. So HER2 positive breast cancers have high levels of HER2 protein and are more likely to grow quickly. And I haven't mentioned the triple negative breast cancer, which is also very aggressive. So there's a lot when we say breast cancer.
There's a lot. Wow, I'm learning a lot too, because some of us just think, oh, it's just one type of breast cancer. I know we hear about the different stages of breast cancer, but we don't, really educate ourselves on knowing that, there is multiple, you know, types. There's a variety, there's a variation of different cancers, breast cancers that you can have. So let's talk about the different stages of cancer. Can you kind of go through, or breast cancer? Can you kind of go through what those stages look like?
So when we talk about staging of the breast cancer, it really has to do with the size of the cancer when it's found.
Okay.
Um, so a stage 1 cancer is very small
Okay.
cancer. Might just be, like I said, in situ. It hasn't gone anywhere other than right in its area, that the little node that has been found. It hasn't spread to the lymph nodes. I'm sorry, I should have started with a stage 0. There is such a thing as a stage 0, and that's a cancer again that's in the site. It's non-invasive, and it's contained within the milk ducts. Milk ducts, candy, milk, milk
They're
ducts.
good too.
They're good too, but not in cancer. The
Not
milk ducts. So the stage 0 is in situ. It's right in that space. It's inside those milk ducts. Stage 1 is very small and it hasn't spread to the lymph nodes. Stage 2 is a little bit larger than 1 and it appears to be more threatening. The stage 3, there's some spread to the lymph nodes. And stage 4 is also called the metastatic breast cancer, and it's spread to other parts of the body, such as the bone and in the liver.
Okay. All right. Okay. Thank you.
That's a lot to unwrap.
It's a lot, but this is good information, and that is why we are here to give accurate information on what to do, what to look for if we ever come, cross this path. We want to be educated, ladies and men. All right, ladies and gentlemen. We want to, educate ourselves on what that looks like. All right, so let's navigate through. I work in the health field as well, and a lot of people kind of get confused with what a mammogram bilateral is, or just a regular mammogram screening versus a mammogram diagnostic. Can you kind of go through what the differences are if my doctor, prescribes a mammogram screening? At what age do I get that screening done? And then when is a mammogram diagnostic with an ultrasound needed? What does that mean? The diagnostic part, because some people get kind of scared with that diagnostic part. And a
So,
tomosynthesis.
and which the last one you said?
Tomosynthesis.
A mammogram is an x-ray of the breast that can detect breast cancer early.
Okay.
And as you said, there are two types of mammograms. There is a screening one, and then there's the diagnostic one. The screening one is used to check women who don't have any signs or symptoms of breast cancer, and it involves taking 2 or more images of each of your breasts. The diagnostic mammogram checks the breast for signs and symptoms that have been found, such as a lump or pain or nipple discharge. And that diagnostic mammogram is used in evaluating changes. So the doctor may say, come back in 3 months, come back in 6 months. They're looking for changes. Um, Mammograms can detect breast cancer as early as up to 3 years before they can be felt.
Okay.
Sometimes, and I say sometimes because in my case, um, we'll we'll let that go. I'll come back to that gory story. But the mammogram was very helpful. Regular mammograms can lower the risk of your dying from a breast cancer. So the earlier you're screened, the better. Women are at all women are at risk. 1 out of 8 women will develop breast cancer over their lifetime. We're finding more young women now are having breast cancer, and that's why the guidelines have been changed to screening women at a younger age. The standard screening age is to start at 40 and to get one every 2 years until you're 74. But if you're younger than 40 and you have risk factors, then the mammogram screening can start earlier.
Okay.
Let's see. Some risk was like, so I can I tell a little of my story.
Yeah, I was just going to ask you to share some of
Okay.
your story and give us also some of those risk factors. What does those factors consist of or entail? What does it look like?
Okay. So I said kind of sort of for things. When I was 17, I had a lump in my breast,
Okay.
and nobody thought cancer, of course. They just said, "Oh yeah, she's hormones, whatever, and they took it out. Nobody ever talked to me about that again. When I was 28, I started noticing a lump in my breast, and I would kept going to my doctor saying, "This is unusual. I'm out center, and I shouldn't have it." It took me all the way up to age 31 to find a doctor who would even pay attention to that. And basically, what he said to me was, "It's nothing, but you come here every 6 months, and the only thing you talk about is this lump in your breast. So I'm going to go ahead and remove it." We're talking in the early 80s where they would not do a mammogram on a woman my age. So I was in a day surgery for the removal of this lump. And I woke up in a hospital bed. And my doctor came to me at about 11 o'clock that night. I'd been there all day. And I was so confident that it wasn't anything. And, he had convinced me that I had actually planned to go out of town, had sent my children ahead to come to California to visit my family. I was going to have my surgery. It was going to be a little lump, and I was going to sleep on the plane to California, and everything was going to be hunky dory. Woke up in this bed. I'm a nurse. It's not a long leap. Anytime you have a day surgery and you wake up in a hospital bed and it's a day surgery for breast cancer, you probably have breast cancer. And so he came in and he said, I'm surprised. And interestingly, you have breast cancer. You shouldn't have breast cancer. There's no reason for it. We don't know why, but you do. Um, I was very healthy, very physically active. I had my children in my 20s. I breastfed. Uh, Body weight, I was 100 pounds at the most at 5'7". Might have been too little, but I certainly wasn't obese. All of the factors that we look at that put people at risk that I knew of didn't exist for me. I said to him, okay, so what's our choice? And he said, well, we can do a mastectomy or we can do this new thing, a lumpectomy. And I said, well, which do you recommend? And he says, well, it's really your choice. And I said, so what do you do best? And so then he said, well, I do the mastectomy best. Well, I really was young and dumb, even at 31. Of course, he did the mastectomy best. That's all he had been doing for 20 some years of his practice. The lumpectomy was new. But I said, well, let's get it done. Let's get it out. And I would like you to take both breasts. I don't want you to come back to me 10 years from now saying that I have breast cancer in my other breast.
And can you kind of tell us what the difference is between the two?
The lumpectomy is they just take the tissue, the lump,
Okay.
and any surrounding tissue, they take a margin so that they can make sure that they got all the tissue. Well, they want to make sure that they got all the tissue in that area that might have breast cancer.
Okay.
So if your lump is the size of a quarter, they take that and then they take a couple of inches around it, that margin, so that they make sure that there's no microscopic cells that have spread.
Okay.
The mastectomy, they remove your entire breast. And many women don't realize that your breast tissue also extends to underneath your arm. So not only that lobular part we're looking at, they take the tissue, surrounding tissue associated with the breast,
Okay.
and just remove that totally from your body. So it's a modified radical mastectomy. So I said, do both because I don't want you coming back. And he says, you are extreme. This is not necessary. This should not be. Well, lo and behold, I spent 5 years doing all my checkups. I had started out with chemotherapy and all of these things. 5 years checkup, I'm breast cancer free. 10 years, I'm breast cancer free. My exam was in November. My mammogram was in November. Breast cancer free. In January, there was a orange-sized lump on the top of my left breast. And I just went into denial. And I knew what it was. It was that regular shape, that orange pilly looking skin, and it was big, and it wasn't there in November when I got my mammogram. That's why I said mammogram. It took me 3 months before my husband got involved, and kind of tricked me into the doctor's office. Said we're going to go pay a bill.
Yeah.
We're going to go pay a bill. And I
Whatever
get,
it
yeah,
takes.
yeah. And we get in there and he says, "Oh, by the way, let's go see your oncologist. We're in the building."
Yeah.
And so then I wound up getting the second mastectomy and the resulting chemotherapy. So I've had my lifetime maximum of the chemotherapy drugs. Now we move into this additional mammogram that we can have, uh, the tomo, I can never pronounce it,
Tomosynthesis.
tomosynthesis. And that's a 3D mammogram. And it provides a three-dimensional view of the breast tissue using three X-ray angles. And sometimes it's used alongside with the 2D mammogram scanning as well. And the whole point is to get to see as many angles and in your breast to see that tissue as clearly as possible. And as I said, some of the guidelines have now changed, and we're able to get our mammogram. Excuse me. This last year, we're able to have younger women screen for breast cancer using a mammography, um, because of the surge of the breast cancer starting in women under 40.
Okay.
So I said I was 31 when I
Yeah.
got my surgery. So if I were to have had a daughter, I have sons who are at risk, who think I'm nuts when I say I want your to do your gene testing. I want you to ask your doctors to examine your breasts. They're like, and I have to bombard them with literature to tell them that they are high risk. And they're high risk because my BRCA2 is a gene mutation. I have that gene mutation, and it is possible that they may have that gene mutation. The gene mutation I was able to track back to my father's family. Well, when I was in 30s, my father really didn't have a relationship with his family. And so he didn't know that his three sisters, he knew he had three sisters, but he knew nothing about them.
Wow.
All three of them had breast cancer. All three of them had bilateral mastectomies. Can you think of, I could have gone 30 years without being crazy trying to figure out what did I do, when actually the data shows I didn't do anything. I didn't make my cells run amok. And women, you don't make your cells run amok. It's something that happens in our bodies that causes our genes to malfunction and produce irregularly. And for me, it was this mutation, the BRCA2. And I've always said I'm my father's daughter, and it's not more evident than that in any other way. Black women are 40 times more likely to die of breast cancer than any other race. Younger Black women have a higher risk for the more aggressive types of breast cancer. And we are so grateful now that last year the screening guidelines changed and younger women can be screened. So the earlier, the better.
Thank you so much for sharing. We were just talking about, I mean, you just gave us so much information right there, but I want to go back to discussing your breast health with your PCP or your provider. Um, there is sometimes an anxiety that comes with discussing that, because you're just scared you're embarking upon something that you don't really know the outcome of. And so should we be fearful, as young women, old women, to go in and get those screenings? We know early detection saves lives, but what does that really mean? um, some people don't have established care
Mhm.
when it comes to, just going to see a regular doctor. Um, what would be your advice to those women that are suffering with, the anxiety of even sitting down with a provider about finding a lump, or, feeling um, vocal pain or tenderness to the breast, um, or all of the other signs that come, sometimes we can overlook, oh, my breasts are hurting because, you know, I'm having hormonal changes
Mhm.
or
Mhm.
what have you. When do we talk to a doctor?
You talk to a doctor minimally every year.
Okay.
You only have one life and this one body. It is our responsibility to our Father to maintain the temple that He has given us. He says in John 3, verse 2, that He would that we prosper and be in health, even as our souls prospers. So we're mind, body, and spirit. But with our body, we need to know ourselves. And when we find or see something that's interesting and different, unusual, we should avail ourselves of the health professionals. It's scary, but life gets scary sometimes. And no action is taking an action. So, minimally seeing a provider every year. If you notice something, go then. Don't wait for the year. If I had not been assertive for myself, I questioned the outcome. God knew the outcome. God provides. But He also put in me, ask the question and keep going back and asking the question. For women who don't have health care, avail yourself of the community clinics. I know the lines are long. I know it's hard to get in and get the care that you need. But we are talking about your very life and the lives of those you love. Advocate for you. And I know most women, we advocate for everybody else,
Yeah.
but we don't stand up for ourselves. So those preventative measures, minimally once a year, seeing a health provider. And if you're not able to, you don't have the insurance, you don't want to talk to people, and all of the things we put, know your body.
Yes.
I knew that that lump had not been there before. One, because I went to nursing school at 17 and I learned about breast self exams and I knew it was something important. I didn't learn it at home. My grandmother had a fourth grade education. She did not teach me that at home. There's a lot of things she didn't teach me about being a woman because nobody taught her. Her mother died when she was young. My mother died when she was young. And my grandmother didn't have this information to pass on to me. But fortunately, I had gone to school and I knew that I should examine my breast. Get a book. We are so fortunate to have the internet. I mean, it's a blessing and a curse. You can't believe everything you read, but you can go to the government websites and look up breast health
Yeah.
and look up breast cancer and what should you do and know yourself. And if you get a healthcare provider that you're not comfortable with and you have insurance, change doctors.
Say that again.
Change doctors. If you are not comfortable with them, change doctors. If they are, can I say, if they're mansplaining,
Yeah.
or even if they're womansplaining, and they're looking at you and they're like, oh, this person,
Yeah.
Get somebody else.
Get somebody else. Yeah.
Get somebody else and change until you find someone that you are comfortable with. There are a lot of physicians in all of those practices. And yeah, it's hard to get in.
Yeah.
And it'll take a while. You change doctors, you might not get to see that new doctor for 3 months. Change doctors until you get someone that you can click with, someone that you feel hears you.
Yes. I always say that, even with my children, finding the best doctors, even for them, was, something that was important to me. And we've switched up doctors because they just wasn't a good fit for our family.
Mhm.
And that's okay. It doesn't make them a bad doctor. It's just
That's
not,
not your doctor.
that's not your doctor. And so, you want to get someone that you feel is going to have your best interests in mind. Um,
And I
and
think we realize that all of our bodies are different. We have different, we're small, we're large, we're in between, we're small breasts, we have lumpy, bumpy breasts, we have just, you name it, we have it.
right.
And our risk factors are different. There's a standardized things that you're a woman, you are at risk.
Yeah.
You're at risk because you're a woman. You have a family history. You are at risk. Breast density. That's something that you should be looking at. The older you are, the higher your risk. And now we look at young women are at risk. So I've been telling my nieces and nephews and their mothers, because the little kids don't, the younger ones, they're like, oh, Auntie Marion, she's always looking for something. I when they hit mid-arc, take them to the gynae, get their breast exam, teach them how to do it, and ask them if they've done it regularly. They need to learn young. It's just like when we started out with our little bitty ones and we said, brush your teeth. We teach them to wash their face and brush their teeth and floss their teeth.
Yes.
Well, we need to teach our young girls how to know their bodies. They need to know their body better than anyone else. So
Agree.
when menarche comes, get in there and get that exam get, and learn. The health professional should teach them how to examine their breast and when. There's several things in that breast exam. It's not just standing up and looking in your breast in the mirror. And yes, you should look at your breast in the mirror and see how they are laying.
Yeah.
Sometimes if you have a lump in there, it might change the position. And you'll say, why am I leaning to the left when I was leaning to the right? And that will lead you to look and feel for a lump. You need to look at them leaning over. How does that look? Look at them laying down, flat on your back and on your side. And then feel the entire breast, which I said goes all the way under your arm. It's important and it's not tedious. It's
Yeah.
a thing you can start in the shower. It's a thing you can do it, but you have to have the will to do it and be mindful of it. Lifestyle factors make a difference. I know we can say, a little bit of smoking not bad for you. Trick,
Yeah.
trick,
Yeah.
trick. They say a little bit of alcohol not bad for you. They don't know enough to know enough.
Yeah. That's good.
Anything that pollutes your temple is a risk factor for you.
That's
It's a
good.
risk factor for you.
So let me ask you a question, because we always talk about women being at risk, but can you kind of give us some insight on men, um, and what that looks like for men, what this, what cancer, breast cancer looks like for men, and when should they get checked?
Again, I said that my sons are at risk because it's the BRCA gene is in our family, And so have a higher risk than most men do. But men in general should also be cautious and know what their breasts look like normally, right? We always say, well, it's the women, but men also can have a breast cancer. The was going to tell you the exact data for men.
Okay. Yeah, I'd be interested. I love statistics.
You love statistics, and I
Okay.
don't like to give statistics that I don't have a complete handle on.
Okay.
So I want to make sure that I'm speaking truth.
Let me look and see. While you're looking for that information, we can come back to that.
Sure.
If you receive a breast cancer diagnosis, um, what are the steps in, you know, moving towards healing in that? Or what are some questions that we would ask our doctor? How do we prepare for that appointment? What does that look like?
So I would say we're looking at preparing for appointments like we do any of our regular appointments. Go armed with your information.
Okay.
What are your concerns? What are the changes that you noted? Uh, Even what you've heard. What you hear all the time isn't the best piece to add in there, but take someone with you
Okay.
because you talk about the anxiety that can happen anytime we talk about our our sexual organs. Ding 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 ding.
Yeah.
The anxiety, the anxiety goes, and you hear. I tell you, I even though I was supposedly I knew when I called my family and told them that night that I had breast cancer, I told them that I had metastatic breast cancer, and that was not the case.
Right.
But I said that because the only breast cancer I had ever seen in my brief nursing career were women who were stage 4 and they were dying. We put it in our mind. You say cancer, I say death. You say cancer, I say, and that is not the case.
Yeah.
It wasn't the case for me.
Right.
I'm 45 years cancer free
It's a blessing
with the gene,
with the gene.
but it was proactive treatment that made a difference. So when you talk, what you tell your doctor is what you see going on, and then take someone with you so that they can clearly hear what's being said. Help rephrase your sentences if you're not, able to speak as clear as you want to, because you get muddled. You
Yeah.
get, uh, you get, the C word just kind of takes over.
Yeah.
Um, and then keep a list based on what the doctor said, what you're supposed to be doing and what you should be looking for,
Okay.
and keep those regular appointments.
Okay.
Breast cancer is treatable.
Are
The
you listening? Are you guys listening? Say that again. Say that again.
breast cancer is treatable. Where we see our numbers for African American women and minority women, it doesn't have anything to do necessarily with us getting breast cancer more than white women. Actually, white women get breast cancer more than we do. It has to do with our treatment plans.
Treatment plans.
Did we get detected early? Did we get quality care? What was the follow up? Now, there are those cancers that are aggressive for African American women, the triple negatives and the HR positives, two positives. But early detection and treatment is what we are in need of. And that leads us to the advocacy role. We all can do a role in not only advocating for ourselves, but advocating for our brothers and sisters, advocating for everyone to have access to quality health care, calling it out when we see that people are being marginalized and things are not available to them. I wanted to say more about the male breast cancer.
Yeah.
Um, um, that the incidence is much less in men, and I still haven't found. I hate it when I can't find the statistic that I want.
Okay.
Sonny, you might have to give me a rain check on that
Okay. No, that's no
because
problem.
men
Do
also
know that
have.
men are not, this, they can get breast cancer.
They can get breast cancer. The cancers fall into invasive and in situ non-invasive.
Okay.
These cancers, the non-invasive is most likely to be the ductal cancer, the ductal carcinoma in situ. That was the one that I talked about. The invasive refers to breast cancers that invade other areas of the body, so that tissue, the lymph nodes, and other places in the body.
Okay.
80% of all male breast cancers are what are called invasive ductal carcinomas, IDC. And I wanted to give you the number. The tissue is going to look dimpled or puckery. There's going to be the swelling. The nipple might turn inward, and there might be some nipple discharge. And there might also be some swelling under the arm. Risk factors are similar to women, uh, and that the breast cancer risk increase as the man gets older. And again, the gene mutation, the BRCA1, the BRCA2. There's also a CHEK2 and a PTN. A man with a BRCA2 genetic mutation have a 6 in 100. So 6 men in 100 that have BRCA2 would get breast cancer. So the risks are lower. How do we get rid of that? I'm sorry. Additional risk would be if you're a smoker, if you're a drinker, if you are obese, if you've been exposed to radiation in your chest. Um, Testicular cancer also kind of goes hand in hand, those hormonal things, breast and testicular. For women, it's our ovaries and our uterine. Um, and excessive breast tissue. So if a man has large breasts, interestingly, in our free California society, marijuana use, marijuana use is considered as a risk factor.
Okay.
So there
Lots
is something,
of information. Lots of information. Men, you
something
are
to
not
know.
excluded. You are not excluded.
It is not excluded, but go to your government websites.
Okay.
Don't take information off of Marion's cancer blog. Go to credible sources. I in my with my students, I teach nursing students. We do not use WebMD
Yeah.
as a credible source of information.
Okay.
Know the source and know that it's credible. And your clinicians are using these same governmental places, the NIH, the National Cancer Institute, the Cancer Society. Cancer Society is a wealth of information to you. It's free on the web.
Okay.
Don't use Marion's website.
Ooh, well, we're going to wrap this thing up. Ooh, we've been given a lot of information today, but I do want to talk about two more things. What breast cancer trials is. I know when we see anything about clinical trials, we run away because we don't want to feel like we're being experimented on. But if you can just kind of touch on that a little bit and tell us what that looks like. Um, with a patient that has, recently received a cancer diagnosis, and what that looks like.
So, with a patient who's received a cancer diagnosis may be eligible for a clinical trial, and if they are often referred by their physician, or if they hear about a clinical trial. A clinical trial is just a study. There are several variables that the researcher wants to look at to see, is there a benefit to a particular therapy or treatment for people with your type of cancer. There's no guarantee that it will work for you, but it adds to the science base. Um, we, as African Americans, and like
Minorities.
lots of other ethnic groups, are skeptical of clinical trials because the misuse in the past by scientists. And those things did happen,
Yeah.
and but they have been making great progress and putting a lot of barriers in place to stop the misuse of people, to give us a sense of trust, and trust is hard to develop. But if we as a people do not participate in clinical trials, things are developed that are not for us. There are treatments and medications that are not for our body types, are not do not fit with our DNA.
Yeah.
Medications that have adverse effect on us. But there's no way anyone's ever going to know that if we don't step up and participate in these studies. Right now, can I talk about the study that I'm involved in as an advisor?
Yeah, absolutely. Please do.
So, University of San Francisco has a clinical trial study going on now, and it's called the Wisdom Study. And this is a nationwide study that's open to women 30 to 74 who have never had breast cancer.
Mhm.
This study is done mostly online. So you go to thewisdomstudy.org and you sign in. There's no cost to participate. You get free genetic testing. You
Wow.
don't have to have insurance to participate. And they will follow you for several years with surveys and update your risk assessment and help you develop a screening plan
Wow.
for your breast health.
This is
So I mean, it's not invasive at all, and it's just someone, researchers, walking alongside you, women to 30 to 74, and you never had breast cancer. They're an adjunct to your personal care physician or your personal care provider, and they are solely monitoring you and assessing your data along with the data of the other participants.
wow.
Now, if we don't sign up, and that's what problem we see right now, we have very low numbers of African American and Latino women participating. But if we don't participate, the data comes out without our input. They can't say 1 in 10 African American women are at risk for triple negative because
Yeah.
they don't have any data that shows that, because we didn't participate in the study. And that's just an example. So I am a community advisor. I volunteer to talk to the researchers about what I've heard from African American women and what their concerns are and how to reach our population.
Yeah.
And every opportunity I get, I tell African American and Latino women and any other woman that will listen about the study because it impacts us all. The
And can
more
you tell us
data
where we can sign up for the study?
we go to www.thewisdomstudy.org.
Okay.
The Wisdom Study, you can just Google the Wisdom Study and it will pop up and you can sign up and put your information in and you can be included. The good part about the study currently is Wisdom Study 0.20. You get the benefit of choosing whether you want to be on the research arm where you get you might get different type of information on screening. What do they call it? Blind study,
Mm,
or you don't have to do that. You can sign up to guarantee to get the whole ball of wax. I want it all. I want all of the assessments done. I want the DNA screening done, the genetic testing. I want to be followed by a clinician every 6 months or a year, whatever my plan says for me.
yeah. Whatever my
So
that's
back,
for.
this was available
It
back
is
when
individual. It's
it's
individual.
individualized. It's patient-centered care. Back in when I was talking about that lump in my breast, they would have said to me, "We're going to have you sign up where you'll be talking to a clinician uh, every 6 months while we evaluate what's going on with the lump in your breast. Someone's going to follow you, and we're going to look at all of the factors." 30 years ago, there was no gene testing, so that would have not have happened.
Yeah.
But now, and it's just a open gate for your health, and it doesn't cost you anything, and you're helping our society at large. So,
So much for sharing that. For our last question, um, where can we find support? What type of, events or professional help, or even community-based organizations are there out here for us?
well, believe it or not, a lot of our churches are very, very busy when we talk about breast cancer, particularly October. But there's also UCSF has a website that leads you to all of our cancer support services that are in the Bay Area. There is also the Women's Cancer Resource Center that is located in Berkeley. Stanford has um, a center for breast cancer. Any of your hospitals will have information about breast cancer. Kaiser and Sutter, there's information there. And again, the internet is your friend.
Hmm.
Put your city in. I want to know where breast cancer support group is. I want to know where a women's resource center is near me. And the door will open for you.
Thank you so much for sharing. I know that I said that was the last question, but I
Okay.
have I have one more question, and it's very, very. It's just how do we support a loved one that has, gotten a recent diagnosis?
Be there. Don't push. Listen. Listen. Sometimes, it's that emotional intelligence. Sometimes we want to join them in the pity party. And, if that's the relationship you have, and you and your girl can roll on the floor and cry and get it. Okay, do what y'all do,
Right.
but just be there. Don't, and there's no don'ts. But when you say you're going to call, call. When you say you're going to come, come. Be a calming factor. Be that person who says, I'll go to the doctor with you and I'll take that note. There are so many people who don't even have transportation to get to their medical appointments. Be that person that'll cash them 20 bucks. That 20 bucks might be the Uber ride they need this week. You never know what the person needs unless you step out and say, I'm willing to walk beside you. And try not to push for that personal information. Let them lead the conversation and you be support, understanding, and kind. Because sometimes when people tell you, girl, my knee hurt, you say, yeah, my back hurt. Not useful. Or as my granddaughter used to say when she was little, you'd say, oh, such and such hurts. Well, mine don't hurt.
Right.
You know, love and kindness. When we talk about treating others how we want to be treated,
Mhm.
just come alongside. That's so important.
Listen, this has been a beautiful conversation. I mean, we can go on and on and on. There's some other things that I wasn't able to touch on just for the time. But can you tell us where we can find information? Well, I'm looking at the wisdomstudy.org here, and there is so much information here. But just tell us, where can we find the organizations and different things that you are a part of?
Oh,
Uh, where can we find?
poor thing. Um, well, I think if I gave you again, I would say UCSF Comprehensive Cancer Center. There is a web page that talks about all of the resources that are offered there. And I spoke about the Women's Cancer Resource Center
Yeah.
in Berkeley. There's also a cancer center at Summit Hospital.
Okay.
And where is that one? Yeah, Summit Hospital. Uh, if I could think of the name. Um, Carolyn Reed. The Carolyn Reed Breast Cancer Center is there at the Summit Hospital. Um, in San Francisco, there is also a breast cancer center at Zuckerberg, and there's one at UCSF. So you got Stanford, you got
Big names.
all yes, yes, yes. Just yeah, and then the community support groups.
Looking into
Glad
that.
Tidings has a group that meets that is a cancer support group, and you just need to call Glad Tidings. That's what 510-783-9377, and leave your name and say that you're interested in participating in that cancer support group. It's Cancer Journey, and it is an online. Excuse me, it is an online cancer support group, and they will call you and give you the access information for that. So there's many, many, many avenues. And Glad Tidings is not only the only church that does those types of things. Talk to your church if you would attend one, or check the church around the corner. You never know what's going on.
You never know.
Yeah,
You,
you never know.
you never know. Well, Miss Marion Harris, we have had an awesome discussion that I think is going to help change the lives and the trajectory of how people even view breast cancer. And so I just want to thank you for coming on and sharing your journey and sharing how you have been proactive in helping, bring a cure to this disease and, just sharing. It's sometimes sharing it is caring goes a long way. It really does, and sometimes just sharing can uplift people and encourage people to either be proactive about their health or the health of their loved ones. And so I want to just tell you that I appreciate you coming on and being in this space with us sunny side uppers, giving us and sharing the wisdom that you have. You have beat this disease twice, and that is pretty impressive.
Look at God.
Look at God. Look at God. Yes, look at God. And so I just want to thank you, ladies. We've heard a lot of information. Gentlemen, if you're watching, we've gotten a lot of information. Educate yourself, be proactive about your health, not just for breast cancer and not just in the month of October, but your health, your holistic health matters. Believe it or not, I mean, Mrs. Harris named off a lot of different things tonight in terms of risk factors. So let's play or let's pay closer attention to our daily lifestyle and making sure that we are uh, being the healthiest we can be. I want to thank you for coming on again. I don't know if you want to share anything, last and final words. If not, you want to say anything else?
I am honored to be here. I really endeavor to only talk things that I am familiar with, but to say with you that we are responsible for our health. We're responsible for our temple, and we can do these things. This is daunting. I said that I wouldn't do anything about my second breast cancer because I just didn't want to be bothered. You don't have the luxury
Yeah.
to not be bothered. We must take care of our health and do what we know to do and put it in God's hands. But we got to do what we know to do. And thank you so much, Sister Sunny, for inviting me.
You're welcome. You've heard it all. You've heard it all here on the Sunny Side Up Show. We are so excited to have you here with us this evening again. Ladies, take care of yourself. Men, take care of yourself. Get those mammograms because early detection saves lives. We'll see you guys later. Take care.